Hi, this is Dr. Matt Lawless, bringing you another knee moment from Knee Fit in 5 and MSM products. Today I was going to talk about patellar tendonitis. So the patellar tendon runs from your tibiotubercle here to the bottom of your kneecap. It's commonly an overuse injury, meaning a change in training patterns, an increase in intensity. Something happens that all of a sudden the patellar tendon starts getting what we call a tendinosis. Some people call it a patellar tendonitis, but in theory it's probably more of a patellar tendinosis where there's not so much inflammation and there's lack of an inflammation. What usually happens is the amount of breakdown that occurs, so whenever you exercise or walk or jump or run or whatever you do, your body's kind of breaking down and then it rebuilds, and a lot of times rebuilds stronger. But if sometimes the force you're applying is more than it can rebuild, so say you have a good workout Monday, you're not quite recuperated by Tuesday, have a good workout Tuesday, Wednesday, a few weeks into this, if you keep training harder than your body's used to, you can get more breakdown than you are repairing, and that's when you start getting pain or a tendinosis, or some people call it too patellar tendonitis, but again it's probably more patellar tendinosis because it's a lack of an inflammation. Patellar tendinosis hurts right at the bottom of the kneecap in the front here. So if your kneecap is right here, you can see right here at the bottom, so you'll feel it right here, is where you'll get sore. So if you've had a change in running, change in shoes, more hill work, more strength work, something happens, you can get soreness here. Usually it's treated early on by resting it, relative resting, meaning you keep exercising but you just kind of back off what's been causing the most soreness. So if it has been running causing the soreness, you may cross-train for a while, do the elliptical machine, do the bike, do swimming, something else that avoids the trauma to the area, and maybe just run a quarter mile or a small distance until this heals up. If you catch it early on, it usually heals pretty quick. Now if it's something you try to train through, so if it starts and you're like, well, it only happens after 3 miles, so I'll just keep running, and then all of a sudden it'll be where it starts at 2 miles, but I'll keep running. So it happens sooner and sooner, and as it lasts longer and longer, it takes longer and longer for this to heal. But again, the treatment is initially just to relative rest it and also stretch. You want to stretch your quadriceps. Make sure you don't have any difficulty getting your quads all the way bent, and it's usually a flexion exercise to work on your quadriceps. Rubbing the area also seems to help. So because it's a patellar tendinosis, it's not getting enough blood supply. Rubbing the area aggressively can help bring blood supply in and help heal it up. So relative rest, stretching, rubbing it. When it starts feeling better, then doing something called eccentric exercise might help make it feel better. Eccentric exercise is the negative part of an exercise. So if I'm doing like a biceps curl where I'm going like this, the shortening part is the concentric, the eccentric is the lengthening. So what it would be is the down part of doing a squat would be a good example of an eccentric exercise. Going downstairs where you're lowering yourself, that is a eccentric exercise. That's the lengthening of the quadriceps muscle. Occasionally, these will become so sore and recalcitrant to treatment, meaning they don't get better with treatment, then the next option is surgery. And what we do in surgery is we actually make an incision. We go into the front of the patellar tendon here, make a little incision in it, and then take out the area that is not healing, and we kind of stimulate some blood flow to the area by drilling into the patella, kind of making some incisions like this to increase the inflammation in the area, increase the blood flow in the area, and that is what can get this to heal. That's the ultimate treatment for this, is surgery. Sometimes you can do other things like injections into the area like PRP, sometimes just putting the needle in there, doing dry needling, or something to stimulate the blood flow to the area is helpful. So what you're trying to do is get more blood flow, because it's a lack of blood flow is what will make it feel better. So that's a brief story of patellar tendonitis. Thank you for listening.